Hi, my name is Michael Langford, and in today's oral presentation, I will be discussing chorioamnionitis, a condition that exists in the medical world of obstetrics. Before I can dive in and give a detailed account of what chorioamnionitis is, I must first present an overview. Firstly, starting with the general anatomy involving chorioamnionitis. This is provided by me in order to give you guys, the audience, good knowledge on what structures are involved with the condition, as well as key notable structures that should just be known for everyone. Followed by a brief introduction of what chorioamnionitis actually is and what structures are involved and why it's important. Following the etiology of chorioamnionitis, or what are some common causes for the condition, incidence and prevalence, the pathophysiology of the condition, so basically the changes that the body is undergoing during the time that the condition is present within the body, some signs and symptoms to look out for so that you know if you have it or don't, and then the different types of treatments, whether it be medical or surgical, that are or that exist in order to treat said condition. Firstly, a general overview of the anatomy of the uterus. I would be putting all of you at a disservice if I didn't inform you all on the anatomy of the uterus before talking about the condition in today's oral presentation. To those who don't know, the uterus is a key player in pregnancy as well as childbirth. It's the hollow organ embedded within a woman's pelvis, and it's also the location where a fertilized egg lands to undergo and develop into a fetus, and so on. After some time, the amniotic sac forms, which holds the fetus inside, suspended in a gel-like fluid known as amniotic fluid. Inside the sac, the fetus develops with the help of the mother by receiving nutrients and needed sustenance through the placenta. For this presentation, the most important key structure that we will be focusing on are the chorion and the amnion. They serve as the membranes of the amniotic sac, the amnion being the innermost of the two, and the chorion being the outermost of the two. The reason why these two are so important to know is because the condition today directly impacts the two. Obstetrics refers to the field of medicine and surgery that deals with childbirth and any aftercare that may concern the mother giving birth. When it comes to this field of obstetrics, there are many conditions that have the ability to affect a mother during childbirth and after. In today's presentation, I will be discussing the condition known as chorioamnionitis in detail. Chorioamnionitis is an infection that can occur anytime during labor. This can be before labor starts, during labor, or even well after delivery. The severity of the condition can also range from acute, subacute, to the worst of them, chronic. Each severity is linked to other conditions that can affect the baby upon delivery as well. If left untreated or neglected, the baby could suffer serious consequences, such as acquiring a neonatal infection, preterm labor, cerebral palsy, PVL, and other frightening injuries. Just like anything else in life, everything is derived from something. And this is no different when we discuss the condition known as chorioamnionitis. The etiology or causation of chorioamnionitis can range. However, the most common causation is bacteria normally found inside the vagina. When the amniotic sac is ruptured for an extended period of time prior to birth, it occurs more frequently. This permits vaginal bacteria to ascend into the uterus. That is not the only causation of chorioamnionitis. There are also other ways for bacteria to enter the body, and attack the fetus. These can be through iatrogenic, peritoneal, or even transplacental means. Those who are at most risk include women who are undergoing their first pregnancy, women who are enduring a longer labor than normal, women who have frequent vaginal exams during their labor, individuals who use tobacco products or alcohol, as well as women who have a STI or other vaginal infections. Now that we've discussed what chorioamnionitis is, as well as some causations and major risk factors for the condition, it's time that we discuss the incidence and prevalence of the condition. About 1 to 5% of all term deliveries are estimated to be somewhat complicated by this condition. Chorioamnionitis is associated with a significantly increased risk of maternal, fetal, and neonatal morbidity and mortality. Babies who have been exposed to this condition have a much higher chance of developing deadly and severe infections during their newborn period, as well as an elevated chance of experiencing neurological impairments in the short and long term. This is thought to be due to a fetal hyperinflammatory response to the infection. Pathophysiology pertains to the study of the abnormal changes in the body's functions that are the causes and consequences of disease process. The pathophysiology of chorioamnionitis is a very complex one. As stated before, bacteria usually ascends up the vagina when it comes to this condition. Usually the vaginal and cervical regions are where the infection first appears. It has been shown that bacterial and viral illnesses can spread vertically to the developing fetus. When it comes to many individuals, signs and symptoms are the body's way of letting you know that there could be something that is causing a ruckus internally. The first time noticing these signs and symptoms should be your notice to visit your local physician or, in a severe circumstance, even the emergency room. When it comes to chorioamnionitis, there are a good amount of common signs and symptoms. These include fever, the increased rapid heart rate of either you, the woman, or the fetus, an unpleasant smelling and unusual color of vaginal discharge, as well as an increased level of sweating. Treatments are designed to be put in place in the unfortunate circumstance that either the mother or the fetus encounter any troubles along the way of childbirth. The usual course of treatment for chorioamnionitis is usually a round of antibiotics to help treat the infection, usually receiving these antibiotics through IV. Sometimes doctors even advise an early birth. This can help you and your child avoid more problems. Your newborn will also receive antibiotics if they have acquired the infection as well. In conclusion, pregnancy can be a very tricky and complicated process with a lot of twists and turns. Conditions such as chorioamnionitis don't necessarily make these times particularly any easier. It is through a good birth plan, as well as potential treatment plan, that these encounters with bacterial infections can be reduced. My name is Michael Langford, and this has been my presentation on chorioamnionitis. Thank you so much for listening, and hope to have you as an audience again.